If you look at the technologies we had 25 years ago, these were lasers that essentially burnt off the skin. There was no question you could lead to improvement in people, but they had downtime for anywhere from 10 to 14 days. They were red for months and months and months. And although the results could be good, there was also a pretty high risk of scarring and a lot of patient dissatisfaction. What that led to over the last decade or so are the whole group of fractional lasers. And these were lasers that didn't burn off the skin, that were much safer to use, that maybe required more treatments, but didn't really lead to quite the degree of improvement we wanted, and still were not necessarily all that safe for darker skin types because they removed the pigment of the skin and didn't always work the best for acne scarring. What has been transformative in this area over the last several years are the development of fractional radiofrequency devices. They work much like lasers, except they're not laser energy, they're actually heat-based. And what makes them very different is they don't do a lot to the outer surface of the skin, so they're much safer in darker skin types, and yet they do so much in depth, and so they're so terrific in acne scarring. And as we get toward the InMode technology, which is the Fractora device, this really has revolutionized radiofrequency resurfacing and bipolar radiofrequency resurfacing because the devices have several tips. And so we can design a tip which is very superficial. So in fact, despite what I said, can be used to treat superficial photo damage, sun damage spots, sunspots, lentigines, freckles, or we could have a slightly deeper tip, which can be used, and we use it all the time, for acne scarring and traditional resurfacing. And then there are even different tips than that, which go much deeper, that can promote tightening. And so we can design our skin and our treatment in accordance with what we want to do. Do we have someone who has mostly acne scarring? Well, we may go deeper with that and get more collagen. Do we have somebody who is darker skinned? It could be an African American, it could be a Latino, or even a suntan Caucasian. Then we're going to want to stay away from the superficial epidermis. Do we have someone who has age spots? We can design what we're treating with the Fractora device based on the tip we're doing, and we've never been able to do this before. We've had people who have been treated over the years with, for example, the well-known Fraxel device who have acne scarring. And either they didn't get the results they wanted, or more commonly, if they had darker skin types, they'd end up with post-inflammatory pigmentary changes, often hyperpigmentation, that can last for months and months and months. When you use the Fractora device, which is not based on laser energy, but based on radio frequency, where the energy is mostly placed in the dermis, and you don't get much disruption of the epidermal-dermal junction where the pigment is, you can treat these people, give them more energy, lead to greater results, and yet have the safety factor of radio frequency. You know, the one wonderful thing about living in the United States is we treat all different kinds of people. And so in the New York area where I practice, you know, we see Asians, we see Latinos, we see blacks, we see suntan Caucasians, we see farmers, we see everybody. And there is no device I have that I can use for resurfacing outside of Fractora that I can use on all of these people. So it's really not one individual, it's everybody. We've done studies with the Fractora device. What we've looked at is trying to take the Fractora in a slightly different direction. Typically, all fractional technology, of which Fractora is one, typically it's a series of treatments. And that series of treatments requires anywhere from 3 to 5 sessions, done 3-4 weeks apart, something like that. You have some patients who remember the old days. In the old days, we would treat them with these aggressive lasers and treat them one time. And yes, they looked terrible, but they got the treatment done at one time. So we undertook a study last year, which is now complete, looking at using the Fractora device and being a little bit more aggressive. And that is, when I say more aggressive, using slightly higher energy, having more treatment concentrated into the skin to see what the results would be after one treatment. And again, this is technology that historically must be used anywhere from 3 to 5 times. And so with one treatment, we did get a little bit more of a wound, but certainly nothing like the wound that you see from laser resurfacing. They're healed within a few days easily. And with one treatment, looking at patients 3 to 6 months later, they already had 50% improvement. Now, compare that to needing 5 treatments over the course of a month to get to probably 80% improvement. So suffice to say, if we treated these people twice, we would actually probably have better results than 5 treatments. We only treated them once, they're all 50% improved, everybody's happy, and it's a one-time treatment. That's never been done with fractional radiofrequency before.